Hi, good evening, everyone, and welcome to this live chat. Let me first of all welcome my two friends, Carlos Nueno, president at Teladoc, and Steve Seuntjens, partner at PHS, Personal Health Solutions Investment Fund. Welcome, guys. Welcome, Carlos and Steve.
Thank you. Welcome.
Thanks, Roberto. It's a pleasure and honor to be here today.
Thank you so much. So welcome everyone, and as you probably saw, we are streaming live on literally all platforms, and so this is the first of a series of live chats designed around the book. And I'll start to give a little bit of a context, and then we'll start this dialogue with Carlos and Steve. As many of you know, the book came out just like a few days ago, now a couple of weeks. It's real, it's here. I also got my copy because I saw a few posts before I was getting my own one. And as the book is designed literally for everyone that is interested in digital health, so and the future of health through the lens of digital transformation. So it's not really a technical or a business book or an essay. Is more a book for everyone that really wants to learn more about what's going on and how digital health is really transforming healthcare, probably in a human way, as I occurred to say multiple times. And of course, it's a key part of this book. And the structure of the book is there are chapters that investigate the first part of the various areas of this future health, and across the various topics, I asked friends to join me and provide their perspectives from the various angles. And so during these live chats that we will host on these Friday evenings, all of them, week after week will join me, and we'll have a chat and a dialogue about the ideas that the book conveys and the perspectives, and how this and what this future of health will look like in a very informal conversation. So again, thanks Carlos and Steve to join the first of these live chats. And this will be, a task, of course, for everyone. So I started to say anyone in the audience that wants to comment, have opinions, and wants to, give feedback, as always, more than welcome. so we can improve as we go. Okay, so with that said, let's get started. Of course, Carlos, from his perspective, joined the chapter that is called Telemedicine and Remote Monitoring. And before I go to him, telehealth clearly is something that we know since many years. The term itself was defined across the 60s and the 70s, so surely is nothing new from a concept perspective. But clearly, COVID, with the lack of physical access, gave an incredible boost to everything around telehealth, because of course the lack of physical access created this need for both of the patients and the physicians to really turn into literally anything that could have helped to bridge this access gap and physical, literally lack of access. So right in the beginning, any kind of video mechanism to get in touch was quickly adopted. But of course, that's not telehealth. That's at best a video visit. And recently I was discussing with somebody, with a policymaker around telehealth, and he told me, if we need to stay with a video visit between a doctor and a patient, it's not even the case to call telehealth. It's just like a video call, and we can use anything, like even this tool, to have that kind of consultation. Of course, telehealth is much more. And so I think first thing that I would like to invite Carlos to contribute is, at Teladoc, of course, guys, you have a much broader definition of that. So I'm curious to hear how you guys define telehealth in your own words, and what are the first things you guys have seen so far, now that we are like 3 years into this, kind of transformation.
Yeah.
Carlos.
Thank you, Roberto, and it's a pleasure to be here. And yes, I think, and you said it very well, and I think in the book you talk about it, which is humanizing medicine through the use of technology. And really, I think telemedicine, telehealth, virtual care, however we want to call it, but providing care through technological means is today a key component of healthcare, and it's going to continue to be. And really, it's less about whether this can be more efficient, which of course it's going to be very important, but it's less about that. I usually hear sometimes, well, it's low cost. Well, it's not low cost. I think it's improving the quality and the accessibility to patients. So it's to me very much linked towards the quality. And if you think about having a physician and a patient, really looking at them spending quality time with the use of technology, that itself increases the quality of healthcare. You know that going into a practice sometimes doesn't mean, even it's face-to-face, doesn't mean it provides good quality. Quality is about listening to the patient, understanding what the situation is, having access to the data. That's really what can provide quality. But then the other angle is that, we have our head of our former head of R&D, who was the founder of Untitled Health, which is a company Teladoc acquired 2 years ago. And Dr. Yulun Wang, who's sometimes referred as the father of telemedicine in the US, he would say that through the use of our technology, the physicians are able to see things that otherwise in the face-to-face would not be able to see. We're able to diagnose things that with the use of technology, we could not do otherwise. And using video technology today allows you to have much more information that we could do face-to-face. So it's increase of quality, it's increase of patients' access to healthcare, it's a more satisfied physician. If you ask them today, clearly physicians, healthcare professionals in general are much more satisfied using technology, and they need it as well. So all of this is, as you say very well, and also in your book, will provide a more sustainable healthcare system.
Right. No, that's really, and this is something that, you know, that many of us that were in this well before the pandemic were quite convinced about, but clearly this global situation has made this, I often refer to the pandemic as a gigantic proof of concept, you know, for digital health in general, and telehealth specifically, has been really making this evident to literally everyone, and also the attention from the policymakers and the institutions in general. It's incomparable to just like 2 years before. Maybe one other thing I was, you know, thinking about when I was mentioning the kind of video interaction. I think that in the future, more and more, we will integrate the communication with not only the document sharing, which is something that already now is happening, but especially with the data sharing, right? So the ability to really have a set of data that will travel together with an aside of the consultation. And at that point, I started to see a telehealth visit between a doctor and a patient almost as an augmented experience versus the one in presence, because in presence would be probably impractical to have real-time access to data, whereas if I'm a patient and you are my doctor and I can authorize you ahead of time to access my data space, and you can have a dashboard at the side of me, you know, consulting with me will give you insights about the data. I think this will elevate the, I would say, accuracy of the medical act to an order of magnitude. So curious, what's your perspective on that? And if you guys are already into this kind of data reach augmented kind of medical visit, which is what I've been, you know, kind of, you know, portraying a little bit in the book about the future of the telehealth.
Yeah, so absolutely. And on our case, so two things, and you going back to the previous question as well. You know, how do we call it? Well, virtual care. We actually speak a lot about whole person care, which in a way is how through virtual care, not only you can touch upon one area of healthcare, but you really can integrate the whole spectrum from primary care, complex care, mental, chronic. And this is about integrating all these capabilities into the same platform and allowing the physician, the primary care doctor, to use them according to the needs of the patient. But then, how can you integrate data? And we have a perfect example with devices, how you can really then use a device so that the patient can have control of the healthcare, use the data of the device, the biometric data, to transform that into actions that the patient can understand, and potentially link that to the virtual care professional that can, at any point, be in touch with the patient and help them in a moment of need. So integrating these three components and do that patient journey as simple as possible, I think that's what really technology can do, and it's so difficult to do in the real world without waiting times and these type of things. So I think absolutely that is a way to increase the quality and the experience of a healthcare encounter.
Fantastic. Yeah, that's it'll take some time, but I think we are incredibly accelerated by the pandemic, and so this will happen probably sooner rather than later. Steve, you know, I would like to build a little bit on that, and starting from you know, your views on the, of course, you know, investment trends, and you also are in the book. I'll show to our friends connected. This is Steve in the book. And I believe this picture is taken from a Past Frontiers Health conference, probably 19 or 18 potentially. So we have seen a lot of investments into the telehealth space in all, kind of different configurations, and also as even Carlos was mentioning, several acquisitions, to kind of consolidate and scale up things. So I'll start with a very simple question. Do you see space for more new startups in the telehealth space? And when I say telehealth, I say this very broadly, so eventually also which parts of telehealth, if you feel it makes sense, there's still space to initiate the new journeys from an entrepreneurial perspective right now into this area.
Yes, thanks, Roberto. I think, as first of all, what's been stated around access, quality, and bringing technology on a human form, we're actually still in the early part of this game in the whole transformation. And I think, what we've been seeing is the power of what this can do and bring, and it's been accentuated by the pandemic, obviously. But, while a lot of people would say in some areas consolidation is happening, there's still a lot of ground to cover. And how can we bring access and quality to those specific aspects that individuals need support, either on a maintenance basis or, an initial care or triage aspect that has to come into play. There are many rare diseases out there as well, if we look at it, that with grouped together brings scale. And I think the aspect of technology brought into this whole is game changing, and really can support the individuals that have been often left on their own, and really give them something that is there on a trusted basis, as a partner, even as an initial access into deeper health.
Yeah, I mean, following your line of thought, sounds like there's still space for new initiative, maybe in niches, maybe in subsegments of the population with specific needs. I would say that probably there would be also opportunities into specific tools or interventions. I'm thinking also to certain digital medicines, probably even certain digital therapeutics that might be, let me say, orchestrated through telehealth platforms that meanwhile will consolidate more and more. Both of you guys think, is this something that we could see at some point in time, or you feel the DTX digital medicine space will be kind of a separate from the telehealth space?
No, well, from my perspective anyway, I think, we're just seeing DTX starting to move. And we've seen a few examples of a few different companies in that space. But I think it gets into more of the holistic care and being able to drive outcomes as a whole, and getting things less pillarized. So bringing things closer together is what will continue to evolve and happen as we move forward. So, as you stated, I think, yeah, the rare disease, but there's the whole DTX. There's also opportunities in different things that we don't see today, because technology is evolving, that we'll be able to address tomorrow. So the aspect, it's all about really embedding and adopting the benefits of technology, and then I think it continues to evolve and grow, and will only get bigger as we move forward.
Yeah, Carlos, how do you feel you guys would play within the DTX space eventually, from a platform consolidation perhaps perspective, or orchestration?
Yeah, so definitely I agree with Steve. I think we are just scratching the surface of virtual care in general, DTX especially. It's just starting. It's great to see that some European countries are taking the lead on how to push. So that's great. And that's created a whole new space. And I've seen some consulting companies forecasting that about 10, 20%, sorry, 10, 12% of the healthcare expenditure is going to be on digital health in the next 5, 10 years. So that's creating a big industry, which is great. And I think all the framework around it, it's the right one. What I do think is that also, especially in public healthcare systems like the European ones, we are going to see more impacts on how to make them sustainable and how to finance them. And these are solutions that can help governments to really manage them. We are going to see more direct to consumer, so more out of pocket money into healthcare from consumers in different ways. And and I think that's not necessarily bad. I think that's something that we have to accept. Otherwise, we won't be able to sustain the healthcare system. And maybe the last trend I think is that also we are starting to see how public healthcare systems are starting to work with private initiatives to provide and to accelerate those solutions. We have a very interesting example in the UK where we are connecting the GP practices with consultants, so that when you go to the GP practice, the GP can immediately have the consultant in the room and virtually and provide more. So really empowering the existing GP practice with more capabilities so that you can reduce the waiting times to see a specialist. So I think these are great examples. We're going to see more of them. We have to see more of them because that's the only way.
Great. Well, by the way, I also believe that physician empowerment, it's a big use of these technologies. Towards the end of the book, when I kind of describe this shift, one of the driving forces will be certainly that one. Steve, one thing that I was thinking useful, and you also added this to the book. We are starting to see this first, I would say, tests also in Europe. I'm thinking, as an example, recently of the Skin Vision, which is one of your portfolio company, that started to distribute in Italy onto the Pagine Mediche platform, which is another startup that in that case is in our portfolio. And it's so interesting to see two startups orchestrating together, a way to access market. I think this in itself is a great sign of the beginning of the phase 2, so to speak, the way I like to say, after many pilots, getting there. And of course, in the States, we have seen things already at scale. I believe when we first met, you probably not too long after started to invest into Pacifica, that now is known as Sanvello and has been even acquired by United Health Group. Maybe I think it would be useful because often, especially for new entrepreneurs, and I'm sure we have a bunch connected, it's quite interesting to understand that the journey, right, that brought these guys from the concept of Pacifica all the way up to scaling service essentially now within United. So would you like to take 2-3 minutes, maybe 4, to remind us the journey from the beginning of Pacifica all the way through the acquisition, and then I'll ask you something about the scale that those guys have reached these days.
Sure, with pleasure, Roberto. First of all, I think the team of Sanvello, or the founders with Pacifica, phenomenal team with great vision and passion. And the element really was to create some of the aspects we were discussing very earlier within this. And maybe just one step back for those that don't know, but Sanvello is support for mental health on stress, anxiety, and depression, just to mention that. But I think, the founders, what really brought me into the whole concept as well, is really what's coming at this from, there's a problem with access to mental health. There are stigmas or different things around it. There, they really looked at the problem area. The other thing, as Carlos was mentioning, is quality. Things have to have quality within them to really be picked up and used. And this is something they heavily focused on. And it had the aspects of course, the science behind it. But it was all about, with mental health, so many people either don't have access to the health system are unknown, and therefore, there's been some numbers of only 1/3 with mental health issues really being accessed or in the health system itself, and that leaves 2/3. And so their whole concept was, how can we create something that is ubiquitous, that people can access and really start utilizing, and as a support tool, and help bring these individuals then into clinical care as needed, so on and so forth. So the scaling of this really, or the buildup of this, was all about the aspects of access, quality, the humanistic side, that was also brought in. And they really looked at, how do we bring this to, as Carlos was saying, we're moving more and more to a consumer or individual basis, and that's where they started with the whole aspect. And really, because of the quality of it, it was readily picked up by individuals. And then universities began to see the issue within their student populations, and it was picked up to be used within university student populations. And at this time, also, the medical side was starting to take notice, through New Zealand at that time as well. But that's about the time United said, well, this is quite interesting, because you already have millions of individuals that are utilizing the platform and engaged with the platform. And we would like to have something that we can then use within the clinical basis as well, and take this and bring scale. And that's really the aspect where the founders really had a passion to try to bring this to as many individuals as possible, and bringing it into United brought the additional scale and support to really help complete that journey.
Great. No, that's great. And now, of course, they with both the pandemic access situation and the mental health needs, I'm sure the level of adoption is quite high.
Yeah.
I don't know if you have a
Yeah.
visibility.
Yeah, I can make, they're predominantly focused on the United States. Well, it is accessible in other countries, but from a market perspective, that has been the focus. But it is across, and reimbursed in multiple states. I think even more than half the states in the U.S. and really then serving tens of millions of individuals. And it's brought in the whole, scaled up the whole aspect with the whole clinical back end that has come to play with it as well. So I think all in all, this is really something that, from an entrepreneurial perspective, a vision and an idea started, and with the aspect of looking at it from an access, quality, humanistic perspective, and then how do we bring this, up to an element of scale, and then further really get the whole journey completed. And that's what the acquisition with United Health helped to accelerate tremendously.
Yeah, absolutely. No, that's great, and thanks for this. I think again, it's very useful, and it's something that we usually do at Frontiers as well. We had companies that came to pitch, then scale, and then they become part of a much bigger organization. It's always interesting to connect back and share the learnings. And just for everyone that is watching us, when I look down, it's because I'm looking at the book and see the stuff that is written here. I was checking the stat about 1 out of 3 people only known to healthcare systems, at least in the States, about a mental health condition, which is quite scary. If you think about that, there are other parts of the world that probably we don't have even a data point available. Guys, we are already off time, as always. When things are interesting, times really flies. I'll take maybe just a few seconds for a question to both of you, and then we'll close the live chat for today. Clearly, digital health scaled first in the US, and for a number of reasons that we all know. Of course, you know, this kind of innovation is needed kind of everywhere, and all the 3 of us are located in Europe this evening. So tell me 1 or 2 things that you believe should be a priority for the European ecosystem in 2022 that is also achievable, right? Because of course the list of things that we would like to happen, it might be broad, but I would say maybe the next most important priority that we would need to focus on in next year, as we are approaching the end of 2021. So who wants to go first?
I can, if you want, Roberto. So yeah, maybe what I would say is, so we are still in the midst of this pandemic, as we were discussing just before the conference. Just today, we learned that there is a new variant, Delta variant, which is spreading again. But maybe the point here is, you know, we've been these last 2 years with the pandemic. Most of the healthcare systems have used telemedicine. Sometimes they were forced because it was the only way to get in touch with patients. Now we are entering into a new phase. Now it's not anymore about whether we can do that or not. It's how we can really enhance that experience. How can we integrate telehealth, virtual care into the day-to-day of both healthcare professionals and patients? And so that's a very interesting new phase, because it will allow us to do that not in a rush, but really to plan ahead and to integrate this in the best possible way, so that in the future we have a more sustainable and human healthcare, as you say in the book. And so to me, the next focus that we would all have to think about is, well, let's really bring this into real practice, into healthcare systems. And we are Europeans, as you said. Well, let's really make sure that healthcare European systems, which are mainly public healthcare systems, do integrate the right platforms, solutions, and let's be a leader globally in Europe with those very important healthcare systems. And let's take use of the reconstruction funds to really put digital health as a top priority in the European agenda.
Okay, makes sense. So essentially, integration in clinical practice across the board, so to become a tool for doctors. And Steve, your immediate next priority we should pursue. What?
Well, on an investment basis, or as you said, a priority as a whole. I think I'll just
as a whole, I would say.
I'll dovetail off of a bit what Carlos was alluding to, and add in. I think, you know, he's really on the right track. This is about now driving the quality systems deeper, the quality digital health opportunity deeper, not just in the systems, because I think whether we're in Europe or we're in the US or wherever we are in the world, it's access is the problem, because of the wait times and triage. And so how do we also within this really start the educational process for the individuals as well? that and get them on adoption and start using this along with the clinicians and professionals, so that we have an end-to-end basis. And from that perspective, I think it's driving the adoption deeper that will be to the benefit of all Europeans on a very vast scale. And I very much support what Carlos said. We need to take this as a top European initiative. And it really, really should be, because of the sustainability challenge of cost and ensuring what we've been talking about, quality. And so I think from that, it really turns into not reinventing everything, but pushing deeper adoption and education.
Fantastic. And by the way, this was not prepared for everyone that is listening. The subtitle of the book is How Digital Technology Will Make Care Accessible, Sustainable, and Human, which I believe we touched on previously. And the entire book is really dedicated to share the understanding of this new way to conceive health, essentially for everyone, as we said in the beginning. Okay, so we took 6 minutes more than anticipated. So I want to thank both Steve and Carlos for their time, the contribution to the book, and also thank all of you for having participated into this live chat. We will come back next Friday at same time with a few more reflections around the book. So wish everyone a great weekend. And enjoy the future of health together as we have been doing this afternoon. Again, thank you, Steve, and thank you, Carlos, and see you all.
Thank you, Roberto. Pleasure.
Thanks, Roberto. Pleasure. See you.
Bye, everyone.
Take care, Carlos.